Welcome to the deep dive, everyone. Today we are diving deep into psychopharmacology, and I'm really excited to have you all along for the ride, especially you future nurses out there.
Oh, it's great to be here.
Yeah. So we're going to be talking about the medications that can really make a difference for folks struggling with their mental health. The ones that affect mood, perception, even behavior.
Yeah, it's amazing how these medications can target specific things going on in the brain, to help manage all those different conditions out there.
Right. And we're going to cover all the major classes of drugs, really break down how they work in the brain. Because I think that's one of the coolest things about psychopharmacology, like how these tiny little chemicals can have such a huge impact on how we feel and how we think.
It really is fascinating. And one thing that I always find intriguing is, did you know that it can take like 2 to 6 weeks for some of these psychiatric medications to actually reach their full effect?
Oh, yeah, that's right. That whole therapeutic lag thing.
Exactly. And that can be, super important for you nurses, especially when you're monitoring your patient's progress, because it's easy to think, oh, maybe this medication isn't working if you don't see results right away. But with these psychotropic medications, you really got to be patient. It takes time.
That's such a good point. Yeah. And I think, for nursing students especially, it can be easy to get caught up in the technical aspects of medications, like dosages and side effects and all that. But it's so important to remember that patience is key.
Absolutely.
So I guess before we get too far ahead of ourselves, let's just take a step back and make sure we're all on the same page. What exactly is psychopharmacology? Like, how would you define it?
Well, it's really the study of how drugs, medications affect our mental states and behaviors.
Okay, so it's not just about the drugs themselves, but it's also about how those drugs interact with, like, our brains and our bodies.
Exactly. And it's a surprisingly young field, I mean, really, it has its roots back in the mid-20th century.
Oh, wow, that recent.
Yeah, it all started with the introduction of, those first antipsychotics. I think particularly, those phenothiazines, they were really a game changer.
Oh, yeah. I remember learning about those in class.
Yeah.
It's just amazing to think about how far we've come since then,
Yeah.
Today, we have just so many different medications at our disposal, each targeting like different aspects of brain chemistry.
Absolutely. And that brings us to a really crucial point, which is that individualized treatment is key. Like, there is no one-size-fits-all approach in psychopharmacology.
Oh, absolutely not. Every patient is unique. They have their own, genetic makeup, their medical history, their cultural background, all those things. And all of that can influence how they respond to different medications.
For sure. And, that includes being aware of potential drug interactions, allergies, any pre-existing conditions. All those things are part of that bigger picture.
It really is like putting a puzzle together. You have to consider all the pieces. So for nursing students, I think one of the most fascinating and potentially daunting aspects of psychopharmacology is understanding how these medications actually work in the brain.
Yeah.
Like, what's actually happening at that microscopic level.
Right. It can be a little intimidating, but it's also, really cool. It all boils down to these amazing little things called neurotransmitters, those chemical messengers.
Right. Those are the couriers zipping around carrying messages between brain cells.
Exactly. And those messages, they influence everything from our mood and our emotions to our sleep, appetite, even our ability to learn and remember new things.
So it's like a complex communication network, like a highway system almost within the brain. And these neurotransmitters are the vehicles carrying all the important information.
I like that analogy. And then, you have those receptors.
Oh, right. The receptors. I've heard that term thrown around a lot. So what exactly are they?
Well, they're basically like docking stations on the brain cells where those neurotransmitters can attach and, deliver their messages.
Okay, so the neurotransmitters are kind of like the mail carriers, and the receptors are the mailboxes.
Yes, perfect. It's like a lock and key system,
Yeah.
The neurotransmitter is the key and the receptor is that lock.
Okay, it's starting to get the picture. So if neurotransmitters are the keys and receptors are the locks, then where do those psychotropic medications fit into all of this?
Well, that's where it gets really interesting. These medications can either increase or decrease the activity of specific neurotransmitters, and they do that by interacting with those receptors.
Okay, so they can either, like, boost the signal or block it.
Yeah, that's a great way to put it. Some medications work by blocking the locks, preventing those keys from fitting. And then others actually make more keys available, amplifying that message.
So they're kind of like master manipulators of these brain signals. They can fine-tune things to manage all these different conditions. That is so cool.
It really is.
So can you give us some examples of how these medications actually work on, like a molecular level. I remember learning about reuptake inhibition.
Oh, yeah, that's a key mechanism.
Yeah. It has something to do with how those neurotransmitters are recycled, right?
You got it. Reuptake inhibition is a common mechanism for many of the antidepressants out there.
Okay.
So basically, the medication prevents the reabsorption of certain neurotransmitters back into that nerve cell that released them.
So instead of being taken back up and reused, they stay active longer.
Exactly. More of those neurotransmitters stay active in the synapse, that little gap between those nerve cells, and that boosts their effect.
So it's like turning up the volume on those brain signals.
Exactly.
I know you mentioned antidepressants. Can you give us some specific examples of how this reuptake inhibition works in that context?
Sure. SSRIs are a prime example.
Oh, right. SSRIs, the selective serotonin reuptake inhibitors. I've heard of those.
They specifically target serotonin, that neurotransmitter that plays a big role in mood regulation.
So when someone takes an SSRI, it helps boost their serotonin levels, which can alleviate those symptoms of depression.
Precisely. Now, we also have things like receptor blockade.
Oh, right. Receptor blockade. So that's just what it sounds like. The medication binds to that receptor and blocks the neurotransmitter from attaching and delivering its message.
You got it, like putting up a do not disturb sign on that receptor.
Makes sense. And then there's enzyme inhibition, right?
Oh, you remembered that one?
Yeah, those are like those tiny little cleanup crews in the brain.
Exactly. Enzymes break down neurotransmitters, so they kind of turn down the volume on those signals.
Okay.
And some medications work by inhibiting those enzymes, which prevents the breakdown of the neurotransmitters and enhances their effects.
Wow. So we've got medications that can boost signals, block signals, and even prevent those signals from being broken down. It's like a whole orchestra of brain manipulation going on.
It's pretty incredible, right?
It is. I'm starting to see just how complex this all is. There are so many different medications, each with its own, unique properties and considerations. It's a lot to keep track of.
It definitely is. That's why it's so important to take it step by step, break it down and really understand the basics.
Yeah, so with a better understanding of how those medications work at, that microscopic level, let's zoom out a little bit and talk about how that translates to real-world patient care.
Okay. Sounds good.
So let's start with a medication category that I think many people are at least somewhat familiar with, anti-anxiety agents, those anxiolytics.
Yeah, those are important ones.
So these are the medications that are often prescribed for conditions like generalized anxiety disorder, panic disorder, things like that.
Exactly. And they can also be used to manage insomnia, muscle tension, a whole range of things. One of the most commonly prescribed types is benzodiazepines.
Oh, right. Benzodiazepines. Those are the ones that can be, habit forming, right?
Right. Yeah, that's definitely something to be aware of. Benzodiazepines like, diazepam, lorazepam, and alprazolam, they all work by enhancing the activity of GABA, a neurotransmitter that has, calming effects on the brain. They can be really effective for short-term anxiety relief, but that long-term use can lead to dependence and, some not-so-fun withdrawal symptoms.
Right, yeah. And I know as future nurses, you guys are going to be the ones educating patients about the risks associated with those long-term benzodiazepine use. So emphasizing that responsible use is going to be really important.
Absolutely. And it's also important to, caution patients about the dangers of mixing benzodiazepines with alcohol or other, CNS depressants.
Oh, right, yeah. Combining those can be really dangerous, even fatal.
Exactly. So now you might be wondering about non-benzodiazepine anxiolytics.
Yeah, are those generally safer for like longer term use?
They can be. Buspirone is a good example of a non-benzodiazepine anxiolytic that's often preferred for long-term anxiety management because it carries a lower risk of dependence compared to those benzodiazepines.
Okay, so that's something to keep in mind when you're caring for patients with anxiety disorders. Now let's move on to another major player in the world of psychopharmacology, antidepressants.
Antidepressants, yeah. They're a cornerstone of treatment for a whole range of conditions, not just depression. We're talking anxiety disorders, PTSD, OCD, even some chronic pain conditions.
Wow, I didn't realize they were used for so many different things.
They're really versatile. And, there are several different types of antidepressants, each with their own, mechanism of action and potential side effects. So let's start with probably the most commonly prescribed type, the SSRIs.
Okay, the SSRIs, we were just talking about those. So those are the ones that increase serotonin levels in the brain.
Exactly. Fluoxetine, sertraline, and paroxetine are some common examples.
Okay, so those are good ones to know. But I know they can also have side effects, right?
Yeah, they can. Some common side effects of SSRIs can include, some GI issues like nausea, diarrhea, and then also things like sexual dysfunction. So it's just important to be aware of these potential side effects and to really educate your patients about them so they can make informed decisions about their treatment.
Right, that shared decision-making is so important.
Yeah.
So we've got SSRIs. What about SNRIs? How are those different?
So SNRIs, those serotonin norepinephrine reuptake inhibitors, they work by blocking the reuptake of both serotonin and norepinephrine. Venlafaxine and duloxetine are two common examples.
Okay, so they're kind of like SSRIs, but with an added boost.
Yeah, you could think of it that way. And they're often used for, depression, anxiety, and like we talked about earlier, even some chronic pain conditions.
Right, right. So knowing about those different mechanisms of action can be really helpful for nurses, especially when you're trying to figure out which medication might be the best fit for a particular patient.
Absolutely. And like SSRIs, SNRIs also have potential side effects. We're talking nausea, and in some cases, they can even increase blood pressure. So careful monitoring is going to be key.
Got it. Okay, so we've got SSRIs and SNRIs. Are there any other types of antidepressants that we should be aware of?
Yeah, there are two other categories, though they are less commonly prescribed these days. One is tricyclic antidepressants, or TCAs.
Okay, the TCAs, those are some of the older antidepressants, right?
Right. Amitriptyline and imipramine are a couple of examples.
Okay.
And they work by affecting multiple neurotransmitters.
Okay.
But they do tend to have more side effects compared to SSRIs and SNRIs.
So what kind of side effects are we talking about with TCAs?
Well, some common ones are, sedation, a drop in blood pressure when you stand up. We call that orthostatic hypotension.
Yeah.
And then also anticholinergic effects.
Okay, remind me what those anticholinergic effects are.
Think like dry mouth, blurred vision, constipation. Those are those classic anticholinergic side effects. They happen because these medications block acetylcholine, another neurotransmitter.
Okay, so TCAs, yeah, those require careful monitoring. And what about that other category you mentioned, the one that's less commonly prescribed these days?
Yes, those are the MAOIs, the monoamine oxidase inhibitors. Phenelzine and tranylcypromine are examples of those. And they work by inhibiting the enzyme monoamine oxidase, which breaks down neurotransmitters like serotonin, norepinephrine, and dopamine.
Okay, the MAOIs. I remember learning about those. Those are the ones with the really serious dietary restrictions, right?
That's right, yeah. Patients taking MAOIs really need to avoid foods rich in tyramine, like, aged cheeses, cured meats, certain alcoholic beverages. Those can all lead to a dangerous spike in blood pressure.
Oh, wow. A hypertensive crisis.
Exactly. That's why patient education is so important with those MAOIs.
Yeah, absolutely. Okay, so we've covered anti-anxiety agents and antidepressants. It's a lot to digest, but this is all so important for us future nurses.
You're doing great.
So are you ready to move on to another essential category?
I am. Mood stabilizers.
Lead the way. Let's do it.
All right, so mood stabilizers, these are the meds that really help manage bipolar disorder, which, is all about those extreme shifts in mood, energy, and those activity levels.
Right. Bipolar disorder, that's where you have those manic episodes, super elevated mood, lots of energy, and then those depressive episodes on the other side of things.
Exactly. And those mood stabilizers, they help level out those dramatic swings, kind of aiming for a more stable emotional baseline.
Yeah, it's like finding that balance point, preventing those extreme highs and those really low lows. So what are some of the, go-to meds in this category?
Well, lithium's probably the most well-known mood stabilizer out there. It's been used for decades to treat bipolar disorder, and for a lot of folks, it's still considered a first-line treatment.
Oh, lithium. Yeah, I remember reading about that. It's actually like a naturally occurring element, right?
It is. And it's thought to work by, influencing the balance of certain chemicals in the brain. But honestly, its exact mechanism of action is still kind of a mystery.
So it's a bit of a mystery, but we know it works. But I've also heard that lithium can be tricky to manage. Is there any truth to that?
Yeah, that's a really important point to highlight. Lithium levels in the blood, they need to be monitored really closely to prevent toxicity, which can cause some serious health problems.
Oh, wow. Toxicity. So it's a powerful medication that needs to be handled with care. What are some of the signs of lithium toxicity that, we as nurses should be aware of?
That's a great question. Early signs, they can be kind of general, things like nausea, vomiting, diarrhea, tremors, and maybe some confusion. But as toxicity progresses, you might start to see more severe neurological symptoms like seizures, coma, and, in extreme cases, it can even be fatal.
Wow, okay, that's definitely something to take seriously.
Hmm.
So close monitoring of those lithium levels is absolutely essential to ensure patient safety. Now, are there any other mood stabilizers besides lithium?
Yes, there are. Some anticonvulsant medications are also used as mood stabilizers. Valproate and lamotrigine are two common examples that you'll probably see. And they're often preferred for patients who, maybe don't respond well to lithium or who experience intolerable side effects.
Interesting. Anticonvulsants, so medications originally developed for seizures, are also effective for mood stabilization.
Exactly. It really highlights, how interconnected different systems in the body can be.
That's fascinating. But I imagine these anticonvulsant mood stabilizers, they probably come with their own set of risks, too.
Yeah, of course. Valproate, for instance, it carries a risk of liver toxicity, so regular liver function tests are going to be necessary. And then lamotrigine, that can cause a serious skin rash, so patients need to be really vigilant about any unusual skin changes, and report those to their healthcare provider immediately.
So just like with lithium, that careful monitoring is key. All right, well, let's shift gears a little bit and talk about another category of psychotropic medications that I think often comes with a lot of stigma, antipsychotics.
Antipsychotics, yeah. They play a vital role in managing those psychotic disorders, like schizophrenia, a condition that, really involves those disruptions in thinking, perception, emotions, and behavior. They're also used to manage certain symptoms of bipolar disorder, like those manic episodes we talked about earlier.
Right. So when someone's experiencing psychosis, they're kind of out of touch with reality.
Hmm.
Antipsychotics can help ground them back in reality.
Yeah, in a way, yes. They help to reduce the intensity of those hallucinations, delusions, and that disorganized thinking. And that allows the individual to, engage more effectively with their environment and with treatment.
That makes sense. And I know antipsychotics are divided into two main categories, right? You've got your typical and your atypical.
Exactly. Typical antipsychotics, which are sometimes called first-generation antipsychotics, they were the first to be developed. Haloperidol and chlorpromazine are some examples you might come across. And they work primarily by blocking dopamine receptors in the brain.
Right, dopamine, that's the neurotransmitter that's associated with reward and pleasure, right?
Yeah.
But too much dopamine is thought to play a role in psychosis.
You got it. So by blocking those dopamine receptors, those typical antipsychotics help reduce that excess dopamine activity that contributes to those psychotic symptoms.
Okay, that makes sense. But I also remember learning that typical antipsychotics, they can have some pretty serious side effects.
Yeah, that's true. They can cause what we call extrapyramidal symptoms, or EPS, which affect movement.
EPS, so these are movement-related side effects.
Exactly. We're talking about muscle stiffness, tremors, even involuntary movements like those seen in tardive dyskinesia.
Oh, tardive dyskinesia, that sounds serious. What exactly is that?
So, tardive dyskinesia, it's a condition that can develop with long-term use of antipsychotics, particularly those typical antipsychotics. And it causes these involuntary repetitive movements, often of the face and tongue, like grimacing, lip smacking, or tongue
Oh,
protrusion.
wow, those sound really distressing. I can
Yeah.
only imagine how those kinds of involuntary movements would impact someone's quality of life.
Yeah, it's a serious concern. And unfortunately, those movements can become permanent if the medication isn't stopped or adjusted.
So it's really important to be on the lookout for any signs of those movement-related side effects when you're caring for patients on those typical antipsychotics. What about atypical antipsychotics? Do those have a lower risk of EPS?
They do. Atypical antipsychotics or second generation antipsychotics, they were developed later, and they tend to have a lower risk of EPS compared to those typical antipsychotics. Risperidone, olanzapine, and quetiapine are some common examples you might see.
Okay, so those might be preferable options in terms of, those movement-related side effects. But I'm guessing they come with their own set of risks.
You're right. While they might be less likely to cause EPS, those atypical antipsychotics can increase the risk of metabolic syndrome.
Right, metabolic syndrome. That's the one with like weight gain, high blood sugar, high cholesterol, all that.
Exactly.
Ah.
So while they might be a better choice for some patients in terms of those movement side effects, you're going to need to monitor them carefully for those metabolic changes.
So it's a trade-off.
Yeah.
And it really highlights, again, that individualized treatment is so important. Choosing the right antipsychotic for a particular patient involves carefully weighing those potential benefits against those risks.
Absolutely. And that's where your nursing skills really come in. Assessing, monitoring, educating, advocating, all those things we've been talking about.
Okay, so we've covered a lot of ground with those, big-name psychotropic medication categories. Are there any other key medications that we should be aware of as nursing students?
Yeah, there are a few more that you'll likely encounter in your practice. For example, we have anti-Parkinsonian agents, which are often used to manage those extrapyramidal side effects that can occur with those typical antipsychotics.
So they kind of step in and help counteract those movement-related side effects.
Exactly. Benztropine and trihexyphenidyl are two common examples. And they work by restoring the balance of acetylcholine and dopamine in certain areas of the brain.
Okay, so those are like our backup medications, ready to go if those movement side effects become a problem. What else is there?
Well, we also have sedative hypnotics. They're primarily used for sleep disorders, but they can also be helpful for anxiety and even procedural sedation.
Oh, right, the sedative hypnotics. Those are like our sleep aids, right?
Mm.
Zolpidem and azopiclone are pretty popular these days.
You're right, they are. They can be really effective for that short-term insomnia. But, it's important to caution patients about the risks of long-term use.
Yeah, what kinds of risks are associated with long-term use of those sedative hypnotics?
Well, long-term use can lead to dependence, and then, you have rebound insomnia when the medication is stopped. It's really important to emphasize that these medications are generally intended for short-term use and that, addressing those underlying causes of insomnia is going to be essential for long-term relief.
Right, so it's not just about masking the symptoms, it's about really getting to the root of the problem. Now, what about medications for ADHD?
Ah, yes, those are important ones too. Methylphenidate, which is commonly known as Ritalin, and then you have amphetamine, often prescribed as Adderall. They're stimulants that can significantly improve focus and attention in folks with ADHD.
Interesting, stimulants. So they actually stimulate brain activity, which seems counterintuitive for a condition that's characterized by, hyperactivity.
I know, right? It seems like it should make things worse, but it turns out that stimulating certain areas of the brain that are responsible for, that executive function and impulse control, it can actually have a calming effect on individuals with ADHD.
Wow, that's pretty cool how that works. But like all medications, these stimulants also come with potential side effects, right?
Of course. They can suppress appetite, cause insomnia, even increase heart rate and blood pressure. So careful monitoring is going to be essential, especially in those children and adolescents.
So we've covered a lot of ground here. We've talked about anti-anxiety agents, antidepressants, mood stabilizers, antipsychotics, even touched on some other important categories like anti-Parkinsonian agents, sedative hypnotics, and those ADHD medications. It's clear that these medications can be really powerful tools for managing those mental health conditions, but they require careful consideration, that monitoring and that patient education that we were talking about earlier.
Absolutely. And, we should probably shift our focus to an aspect of psychopharmacological care that's especially relevant for you nursing students out there, those ethical and legal considerations.
Oh, yeah, that's where things can get a little tricky. We're talking about patient rights, informed consent, and even those situations where, involuntary treatment might be necessary.
Exactly. As future nurses, you're going to encounter situations where those ethical and legal principles kind of intersect with psychopharmacological care. And it's really crucial to have a solid understanding of these principles so you can provide that safe and ethical care.
Okay, so let's start with the foundation. Let's talk about the patient's right to refuse treatment. I know this is like a fundamental principle in all of healthcare, but how does it apply specifically to psychopharmacology?
Well, every patient, regardless of their mental health status, they have the right to make decisions about their own medical care, and that includes the right to refuse medication.
So that autonomy is a cornerstone of ethical healthcare. We respect our patients' right to make choices about their own bodies and their own treatment.
Absolutely. Patients have the right to be informed about their treatment options, including those potential risks and benefits, and to make choices that align with their values and their preferences.
But I know there are exceptions to this rule, right? Like in those situations where a patient's capacity to make decisions might be compromised because of a severe mental illness.
That's a really critical point. In cases where, a patient poses an imminent danger to themselves or others because of a severe mental illness, involuntary treatment might be necessary.
And I know there are specific laws that govern these situations, right? Like laws that vary from state to state that outline the criteria for involuntary hospitalization and medication administration.
Precisely. Understanding that legal framework surrounding involuntary treatment is just crucial for providing that safe and ethical care. It's really important for nurses to be familiar with the laws in their own jurisdiction.
Okay, so that's definitely something that we need to be aware of as we move forward in our careers. Now, what about court-ordered outpatient treatment? I've heard that term, but I'm not entirely sure what it entails.
Yeah. Court-ordered outpatient treatment sometimes is referred to as assisted outpatient treatment, or Kendra's law in some states. It's a legal mechanism that requires individuals with severe mental illness to comply with a treatment plan, while living in the community.
So it's a way to kind of ensure patients receive the care they need while still maintaining some level of autonomy and avoiding hospitalization.
Exactly. The goal is really to prevent relapse, hospitalization, and potential harm by providing that ongoing support and treatment in a less restrictive setting.
It sounds like a delicate balance, between protecting individual rights and ensuring public safety.
It is. And these situations require really careful consideration, ethical decision-making, and a deep understanding of both the legal and clinical aspects of care.
This is a lot to take in. But it's clear that these ethical and legal considerations, they're woven into every aspect of psychopharmacological care.
Yeah.
It's not just about the medications themselves, but about that complex interplay between patient rights, legal frameworks, and our responsibilities as healthcare providers.
You've summed it up perfectly. Now, before we move on to that final part of our deep dive, where we'll explore some practical tips and strategies for providing that exceptional care to patients receiving those psychotropic medications, let's just take a moment to reflect on everything we've covered so far.
Yeah, that sounds good. It's been a whirlwind tour of psychopharmacology. We've talked about the intricate workings of those neurotransmitters, the diverse landscape of medications available, each with their own unique properties and those considerations. And then we just delved into those ethical and legal complexities that can arise in this field. It's a lot to absorb, but I feel like I'm starting to grasp those fundamentals.
You're doing great. And remember, this is just the beginning of your journey. As you continue to learn and grow as nurses, you'll develop an even deeper understanding of these concepts and how they apply to real-world patient care.
I'm excited to continue that journey. Bring on that next deep dive. All right, so welcome back to the deep dive, everyone. We've been on quite a journey, haven't we? We've explored the science behind these psychotropic medications, talked about the different drug classes, and really dove into those ethical considerations that are just so essential for, us as nurses.
Yeah, and now we're going to shift gears a little bit and focus on the practical side of things, those essential skills and strategies that will help you guys become truly exceptional psych nurses.
Okay, I'm ready to put all this knowledge into action.
Sure.
So what are some of those key things that we need to keep in mind when we're caring for patients who are receiving these psychotropic medications?
Well, one of the most important things is to remember that psychopharmacology, it's just one piece of the puzzle. It's a powerful tool, for sure, but it's most effective when it's combined with, a compassionate and patient-centered approach.
Right, so it's not just about administering those medications. It's about building that therapeutic relationship with our patients, understanding their individual needs, supporting them on their mental health journey.
Exactly. And that starts with effective communication. How can nurses really create a space where patients feel comfortable opening up about their experiences and their concerns?
That's such a great question. I know communication is key in any area of nursing, but it seems especially important in mental health care, where patients might be dealing with really sensitive issues, facing a lot of stigma.
You're absolutely right. Building that trust and rapport is essential, and active listening is crucial. Really tuning into what your patients are saying, both verbally and non-verbally. Pay attention to their body language, their tone of voice, their facial expressions, all those subtle cues that can provide really valuable insights.
It's almost like reading between the lines, sensing what they might not be saying out loud.
Precisely. And when you're communicating with patients about their medications, use clear and understandable language, Avoid all that medical jargon that might just confuse or overwhelm them.
Right, meet them where they are, explain things in a way that makes sense to them.
And remember, be patient. Some patients might need more time to process information, or they might need things explained in different ways. So it's about respecting those individual needs and learning styles.
Okay, so clear communication, active listening, patience, those are all essential. What about empathy? I know that's a crucial ingredient in any therapeutic relationship, but how does it specifically apply to psychopharmacology?
Well, empathy is about really putting yourself in the patient's shoes, trying to understand their experiences and emotions, even if you haven't personally walked in their shoes.
So it's about seeing the world through their eyes, even if just for a moment.
Exactly. And when patients feel heard and understood, they're so much more likely to open up, to share their concerns, to actively participate in their treatment plan.
So empathy fosters trust and collaboration, which are essential for those positive outcomes.
Precisely. And speaking of collaboration, let's talk about empowering patients. It's all about helping them take ownership of their mental health journey.
Empowering patients, that sounds really important. How can nurses do that, specifically in the context of psychopharmacology?
Well, education is a really powerful tool. Provide your patients with clear and accurate information about their medication, its purpose, potential side effects, and how to manage those side effects. Encourage them to ask questions, to share their concerns, and to be active participants in their treatment plan.
So treat them as partners in their care, not just passive recipients of treatment.
Exactly. And help them develop coping mechanisms and strategies for managing their condition, beyond medication. It's a holistic approach. It's addressing not just the symptoms, but the whole person.
I'm seeing how communication, empathy, and patient empowerment are all really interconnected. They work together to create that supportive and therapeutic environment where patients feel safe, understood, and empowered.
You got it. Now, let's switch gears a little bit and talk about some practical tips for monitoring patients on those psychotropic medications.
Okay, this is where our nursing skills really come into play, right? We're the ones on the front lines, observing those patients, assessing their responses to medications, and intervening when necessary.
Exactly. And remember, monitoring is an ongoing process. It's not just about checking those vital signs or asking a few routine questions. It's about being vigilant, being observant, picking up on those subtle changes in a patient's behavior or mood that might signal a need for some adjustments to their medication regimen.
So it's about being attentive and proactive, noticing those little cues that might indicate that something's not quite right.
Exactly. And being knowledgeable about those medications, their potential side effects, and the signs of those adverse reactions.
Right. We already talked about some of those potentially life-threatening adverse effects like granulocytosis, serotonin syndrome, neuroleptic malignant syndrome, and tardive dyskinesia. Those are definitely red flags that require immediate intervention.
Absolutely. But there are also other less severe side effects that can still really impact a patient's quality of life and that might require some adjustments to their meds or some supportive interventions.
So what are some common side effects that, we as nurses should be on the lookout for?
Well, weight gain is a common side effect of a lot of those atypical antipsychotics. So it's important to monitor those patients' weight regularly and encourage those healthy lifestyle habits, like diet and exercise, to kind of help minimize that side effect.
And what about those anticholinergic effects that we talked about earlier? The dry mouth, blurred vision, constipation.
Yeah, those can be really bothersome for patients. Be sure to educate them about these potential side effects and offer some strategies for managing them, like, sugar-free candies for dry mouth, increasing fiber intake for constipation.
Okay, so it's about anticipating those side effects and being prepared to address them proactively.
Exactly. And remember, always be alert for those potential drug interactions. Many patients taking those psychotropic medications are also taking other meds for coexisting conditions.
And those interactions can be significant, right? Like they could either increase the risk of side effects or even decrease the effectiveness of the medication.
Absolutely. Always double check for those potential drug interactions before administering any medication. And be sure to educate your patients about any potential interactions with those over-the-counter medications or those herbal supplements that they might be taking.
It's all about being thorough and proactive,
Yeah,
looking out for our patients' best interests.
you got it. All right, let's wrap up our discussion of those practical considerations with one final but crucial aspect of nursing care in psychopharmacology: patient education.
Patient education is so important, isn't it? Empowering patients with that knowledge about their medications can really make a huge difference in their treatment outcomes.
It really can. Patient education is all about helping them understand their medication, how it works, what to expect, and how to be those active participants in their care.
So what are some key points to cover when you're educating those patients about their psychotropic medications?
Well, start by explaining the purpose of the medication in clear and simple language. What is it supposed to do? How does it work?
Okay, lay the groundwork first.
Exactly. Then discuss those potential side effects, both common and those serious ones. Be honest and upfront about those risks, but also emphasize that not everyone experiences those side effects. And, a lot of them can be managed effectively.
It's about finding that balance, informing them without scaring them.
Precisely. And be sure to emphasize the importance of taking the medication as prescribed, even if they start feeling better. Explain that whole concept of therapeutic lag and why consistency is just so crucial.
And encourage them to report any unusual symptoms or concerns to their healthcare provider right away.
Absolutely. It's all about open communication and that collaborative approach.
Well, this deep dive into psychopharmacology has been incredibly insightful. I feel like I've gained a much deeper understanding of these medications, their complexities, and just how crucial our role as nurses is in ensuring their safe and effective use.
I'm glad to hear that. And remember, this is just the beginning of your journey. As you continue to learn and grow as nurses, you'll develop an even deeper appreciation for all the nuances of psychopharmacology and how it really intersects with the art and science of nursing.
And to our listeners, you are the future of psych nursing. Your dedication, your empathy, your expertise, it's all going to make a world of difference in the lives of your patients. So keep learning, keep growing, and keep shining.